My name is Debbie Clark and I work with the Health and Social Care Partnership between Clackmannshire and Stirling Council, and I'm a telecare assessor. So what I do is go into people's homes and basically assess to see if there's what variety of technology we can put in place to allow people to live at home as independently as possible for as long as possible. We use lifestyle monitoring systems quite often within Clackmannshire Council. It's motion and activity sensors that are placed discreetly around the service user's home. What it allows us to do is it allows us to give us an objective tool basically to complete a comprehensive assessment of that service user's needs and perhaps tailor a package of care based on what evidence we get from these charts. The biggest impact for the now would be for early intervention. By using systems such as Just Checking or any other lifestyle monitoring system, we can see what the service user's capabilities are on their own when they're in their house living independently, and it can maybe show us gaps as well where they need additional support to be put in. So it can be used to reduce the package of care, the level of support required to allow that person to remain at home. So around hospital discharges, we put the service in quite often as well. What we find is that the hospital can sometimes assess a certain need for the person, and we often get a different point of view from a family member. They're obviously really concerned about their loved ones coming home from the hospital, unsure about what their capabilities are. We can offer by putting this monitoring system in place that allows the family access to the service as well to see what their loved ones are capable of managing. We use it alongside bereavement. When our bereavement workers are out and they're maybe wanting to reduce the care package, we can reduce the care slowly, and introducing the lifestyle monitoring system at the same time allows the family and the service user themselves to see what's working well and where the care isn't necessarily required. I think sitting down with families and explaining to them and showing them what the technology is and how it works, when they see how activity is monitored and it's very discreet as well, which obviously is good for the service users, they can then see that physical support that was in place perhaps isn't required as much as it is, or not at that time, whereas we could keep it in place at certain other times when the support is more at need for the person. Overnight care needs, for example, families tend to be quite concerned about their loved ones overnight, maybe having a falls risk, whereas if we can bring in something like the lifestyle monitoring system alongside another piece of technology, maybe like a bed occupancy sensor, which would alert to falls risk to a community alarm. By using these kind of pieces of technology side by side, we can bring the families round to be more understanding and seeing what support's in place without having physical need for overnight care, especially in that kind of situation. It can be used to help like part resource care packages, so something like if a lunch call is needed, we could maybe look at part resource in a care package to get that person home from hospital, putting the lifestyle monitoring system in, leaving the service user something in the morning, using the lifestyle monitoring service to monitor if the person's actually able then to go through their kitchen, are they opening their fridge, are they using their kettle. By charting this information, we can see what that person's actually doing in their house and if they're able to manage. So if we can put that in place, it'll give the confidence that the patient can come home safely from hospital as well. So for bringing in a lifestyle monitoring system, one of the main considerations would be, have you got the staff available to analyse the data? You need somebody to interpret the data and read the charts correctly as well. The one benefit of it is it's a completely confidential system, so we can identify who the service user is, but it's completely confidential externally. One of the other risks that we always think about with having the monitor systems is they can be quite easily removed, in all honesty, because they are only adhesively stuck to door frames and appliances. They can easily fall off. So again, it's about reading the data and monitoring that just in case anything does happen. We actually used the lifestyle monitoring systems quite well working an initiative with our learning disabilities team. We used the Just Check-In systems to transform overnight care needs. We put it into a variety of service users, and it significantly reduced the amount of overnight care that was required. It allowed the service users themselves to realise that they had more independence, they were able to live on their own safely, and it obviously is a benefit for a council service. It reduced our costings dramatically, not having to pay an external provider.